In today's video, we'll reveal some unexpected symptoms to be aware of that could potentially save your life or the life of a loved one. Heart attacks are among the most prevalent medical emergencies in the United States. Someone experiences a heart attack every 40 seconds, and the problem is not just their prevalence, but also the difficulty in recognizing them early enough for effective intervention. For example, according to Harvard University research, about half of all heart attacks are mistaken for less serious problems. Heart attacks transpire when blood flow becomes obstructed, leading to heart muscle damage. Being able to recognize the very early symptoms months or even years in advance can in some cases allow people to take action and avoid heart disease altogether. And likewise, understanding the signs of an imminent heart attack can be enough to buy some precious time and seek help. So today, we'll explore the lesser known very early symptoms, as well as signs that immediate action is needed. But before we dig in, can you do us a favor? Click on the thumbs up and help us spread the word about heart disease prevention, and ring the bell to stay up to date with our latest videos. We want to make sure you get the latest info so you can live a long, healthy life. And stick around to find out how to get 2 heart-healthy free gifts. We guarantee both you and your heart will love them. Okay, let's get into it. Number 9. Epigastric pain or heartburn. Epigastric pain can be a very early indicator. This is a pain in the upper abdomen, similar to indigestion or heartburn. The nerves that supply the heart and the gastrointestinal system are closely connected. As a result, problems with the heart can sometimes be felt in the upper abdomen. If this pain is persistent, worsens with activity, or is accompanied by other symptoms, consult a doctor, whether it's heart-related or another issue. These symptoms can make life miserable and can develop into a number of more serious conditions, so it's well worth getting onto as early as possible. Number 8. Sleep disturbances. Sleep problems such as sleep apnea can lead to low oxygen levels in the blood, increased blood pressure, and strain on the heart. Over time, these factors can contribute to the development of heart disease or exacerbate existing conditions. Studies suggest that sleep apnea increases the risk for heart failure by up to 140%. And researchers believe that around 80% of sleep apnea cases go undiagnosed, which means that by recognizing and dealing with sleep disturbances early, there is a potential to avoid the problems which develop slowly over time. Essentially, proper diagnosis and treatment of sleep issues can nip them in the bud and stop heart problems progressing. After all, prevention is far better than a cure. Number 7. Erectile dysfunction. Erectile dysfunction is often described as the canary in the coal mine for heart disease, as it may indicate reduced blood flow, which can be a result of arterial blockages. In fact, research by the Mayo Clinic found that men with erectile dysfunction were 80% more likely to develop heart disease in the future, compared to men without it. Since the arteries in the penis are smaller than those in the heart, erectile dysfunction may occur before any noticeable heart symptoms. So, if you're experiencing erectile dysfunction, talk to your healthcare provider. They can evaluate potential underlying causes, including heart-related issues. Don't be embarrassed by this problem. It's a medical condition, and they are professionals who deal with this stuff every day. You never know, it may just be a blessing in disguise, a catalyst to help you take action early and prevent heart disease. Number 6. Leg swelling or pain. Peripheral artery disease is a circulatory issue that can cause leg pain or swelling. The same factors that contribute to peripheral artery disease, such as atherosclerosis or plaque buildup in the arteries, can also lead to heart attack. Recognizing and addressing peripheral artery disease can help reduce the risk of heart attacks and other cardiovascular events. Treatment for peripheral artery disease may include lifestyle changes, medications, or in some cases, surgical intervention. Number 5. Irregular heartbeat or palpitations. Irregular heartbeats, also known as arrhythmias, occur when the heart's electrical system malfunctions, causing the heart to beat too fast, too slow, or irregularly. Some arrhythmias can be harmless, while others may indicate underlying heart problems, such as weakened heart muscles, heart valve issues, or coronary artery disease. By understanding these less common signs and early indicators, individuals can be more proactive about their heart health. Regular checkups and open communication with healthcare providers can help identify potential issues before they develop into more serious problems. Additionally, maintaining a healthy lifestyle by exercising regularly, eating a balanced diet, managing stress, and avoiding smoking can significantly reduce the risk of heart disease and heart attacks. Before we get to number 4, Heart Disease Code would love to give you a free book, The Surprising Truth About Fat and Cholesterol, plus the first episode of the untold story of heart disease, something that everyone concerned about heart health should watch. Click the link in the description below to claim these free gifts. Okay, let's get back to the list. Number 4. Unexplained sweating. Sudden, unexplained sweating can be another warning sign. This may occur even if you are not engaging in any strenuous activities. In this case, sweating occurs when the heart cannot pump enough blood to the skin, leading to a change in body temperature and sweating. While sweating can occur for a number of different reasons, it's worth being aware of, especially if it's combined with other symptoms. Number 3. Breathlessness. Another heart attack warning sign is shortness of breath. This may feel like suffocating or gasping for air, even when you're not exerting yourself physically. When the heart cannot pump enough blood to meet the body's oxygen demands, the brain signals a feeling of shortness of breath. Shortness of breath can occur in the weeks and months before a heart attack, particularly during physical activity or exertion. It may be an early warning sign that your heart is not functioning optimally, potentially due to reduced blood flow or a weakening of the heart muscle. Number 2. Fatigue. Unusual tiredness, weakness, or fatigue may appear suddenly or develop over time, making simple activities like climbing stairs or walking to the mailbox exhausting. Like shortness of breath, fatigue can be caused by a lack of oxygen-rich blood reaching the muscles, including the heart muscle, which means your body doesn't have the energy it needs to carry out tasks. Of course, fatigue can occur for a number of other reasons, such as if you've been pushing yourself more than normal, a poor diet, and stress. But if it's unexplained or you're concerned, then talk to your doctor. Likewise, feeling dizzy or lightheaded can indicate that the heart can't pump sufficient blood to the brain. You may feel as though you're about to faint or lose balance. This is sometimes combined with feelings of nausea or vomiting, which occurs when the heart cannot pump enough blood to the digestive system. Number 1. Pain in the chest, jaw, and arms. The most common warning sign of a heart attack is chest discomfort. This sensation may include tightness, pressure, squeezing, or burning that might spread to the arms, neck, jaw, back, or stomach. Some describe it as feeling like an elephant is sitting on their chest. This discomfort may be intermittent or constant. Chest discomfort arises when the heart muscles don't receive enough oxygen-rich blood, typically due to coronary artery blockages. These blockages can result from plaque buildup, blood clots, or artery spasms. It's important to note that chest discomfort during a heart attack may not always be severe. In fact, it can be mild or even absent in some cases. But before jumping to any conclusions, take note that chest pain can be caused by a variety of other conditions besides heart attack. Some common causes of chest pain include gastroesophageal reflux disease, a condition where the acid in the stomach flows back into the esophagus, causing a burning sensation in the chest, muscle strain or injury, panic attacks, and lung problems such as pneumonia, pulmonary embolism, or collapsed lung. Whatever the cause, if you experience chest discomfort, get it checked out. Finally, if you're experiencing any of the symptoms we've discussed, don't just drive yourself to the hospital. Call the hospital or your medical clinic and talk to them about what to do. This is a common mistake, and the last thing you want is to have a medical event while driving. And remember, prevention is always the best medicine. No matter whether you've already developed some heart problems or are taking a proactive long-term approach, it's important to exercise regularly, eat a heart-healthy diet, and manage stress. We've covered these topics in detail in our other videos, so be sure to watch them. Finally, make sure to get regular checkups. Regular medical checkups can help identify risk factors and potential issues before they become serious. Schedule appointments with your doctor to discuss your heart health and address any concerns. So, to recap, the signs to look out for that foreshadow heart attack are: Number 9, epigastric pain. Number 8, sleep disturbances. Number 7, erectile dysfunction. Number 6, leg swelling or pain. Number 5, irregular heartbeat or palpitations. Number 4, unexplained sweating. Number 3, breathlessness. Number 2, fatigue. And number 1, pain in the chest, jaw, and arms. Recognizing the signs of heart disease is key to prevention and early intervention. By paying attention to these warning signs, you can significantly reduce your risk of developing heart disease, or take immediate steps that could save your life. We hope you found this video helpful. Please leave a comment with any thoughts, questions, or requests for future video topics. And remember to get your 2 free gifts: The Surprising Truth About Fat and Cholesterol, and the first episode of The Untold Story of Heart Disease. Just click the link in the description below to get them. And remember to like this video and click the subscribe button, so that you can stay up to date as we release new videos. Thank you so much for watching. We hope you have a happy and heart-healthy day.